this particular Teams meeting. We are a meeting of the Office of Minority Health and Equity, also known as NOMHE. This is our fourth quarter advisory committee meeting. We will be pausing the start just for a few minutes to allow for quorum. Thank you so much for joining. So who's missing? So Dr. Hickson. Alex, I just heard from advisor Maggie Crespo-Salas. She says she's having problems joining.
I'm on already. Tina,
oh, you're here. Oh,
yes.
Wonderful.
Sorry, it was on my end, but I figured it out.
Do you mind also turning on your camera so we can make sure that works for us?
Yes.
Let's see. There you are. Good morning.
Good morning.
All right. We need at least one more, Mr. Chair. Am I right on the count, Alex? We need 5. Oh, no. Oh, no. Okay. So that's that. Mr. Chair, we are 5 minutes into the hour. May I suggest that we get started with our welcome and opening remarks before roll call? And perhaps we will have one additional member in time for necessary quorum.
Absolutely. Yeah, I would be happy to start with the welcome, and then we can wait on more committee members to join.
All right, Mr. Chair, I'll get us started in one moment.
Awesome.
Oh, and Bishop, we have one person I think that should be coming on right now. Oh, I was having internet problems with Cox. Okay. Alex, if you could just keep an eye out, I am expecting Bishop Bonnie Radden to join. With that, I would like to welcome everyone to the November 18th, 2025 meeting of the Nevada Office of Minority Health and Equity. This is our fourth quarter advisory committee meeting. My name is Tina Dortch, and I am NOMHE's program manager. I am one of the NOMHE staff that will be supporting today's meeting. I'm doing so along with Ms. Karina Fox and Ms. Alexandra Neal. And before I begin, can I please have confirmation that the recording has begun for the meeting?
Yes, the meeting is recording.
Thank you. Let the record show that we're also being supported by professional American Sign Language interpretation, and that closed captioning is also available if anyone requires that assistance. This meeting is being conducted remotely via the Teams platform. And as a few other friendly reminders, just let me mention that we ask that all of our telephones be silenced during the meeting, and that for anyone who is speaking, that you state your name each time that you speak, so that we can accurately transcribe minutes. And for our advisory committee members, whenever you are speaking, we ask that you unmute yourself, but that you keep your cameras on for the duration of the meeting. For our non-advisory committee members who are going to be providing presentations, we also ask that you unmute and turn camera on only during your presentation. And then for our valued members of the public, the only time that you will be able to engage is during the public comment section. And at that time, you will unmute yourself and turn your camera on, and our chair will be giving further instructions for you. We also kindly ask that you would please just enter your name and your title, if applicable, in our chat box so that we can make sure we have an accurate reflection of who attended today. Our chair is Mr. Nicholas Dunkel. He's going to be managing our agenda from this point forward. And Mr. Chair, if you would like to start by noting the time of the meeting, the agenda is yours.
Thank you so much, Ms. Dorsch. With that said, I will go ahead and call today's meeting to order. It looks like our time now is 10:09. So I'd like to go ahead and call the meeting to order today on November 18th at 10:09 a.m. Before I proceed, Ms. Dorch, I believe we do have quorum. So I know we had talked about maybe jumping into the welcome, but I think we may have quorum at this point. Can we confirm?
I'll do roll call right now, Mr. Chair. Nicholas
good.
Dunkel.
Present.
Dr. Samuel Hickson has an excused absence today. Angela Wilson.
Here, thank you.
Thank you. Tiara Flynn.
Good morning, I'm here.
Thank you. Dr. Andrew Rise.
Present, I'm here.
Thank you. Reverend Dr. Deborah Whitlock Lax. Nancy Bowen has an excused absence. Bishop Bonnie Radden. Bishop did send me a text message. She was having some internet issues on her end and is trying to resolve them, Mr. Chair. Maggie Salas Crespo.
Present.
With that, 1, 2, 3.
It's Bishop Bonnie, I'm here. Thank you.
Oh, thank you, Bishop. With that, we do have quorum, Mr. Chair. Our non-voting ex officio member, who is our legislative advisor, Senator Rochelle Wynn, is absent, given our special session that's in place.
Completely understandable. And thank you, Ms. Dorch, for taking the roll call and getting us started here today. So with that said, we'll go ahead and proceed and get started with a bit of a welcome and the opening statements here. So thank you so much to all the advisory committee members present for attending, as well as for the public and guests. Many of you are already doing so, but if you have not yet done so, please put your name and title in the chat box. This helps us connect as we're kind of working through this conversation here. And love to see faces kind of popping in as we're going through the meeting. We'd love to see who's on the call as we go through with this. With that said, I'll go ahead and do a bit of an opening statement here. Oftentimes I use kind of this point in the agenda to reflect upon kind of occurrences that are happening, maybe health-focused information and prominent issues within public health for our state. So with that said, we've got a pretty large occurrence here that we like to highlight as we go through in our November meetings. Historically, Native peoples in Nevada have faced displacement, broken treaties, and systemic marginalization. This month, November, is Native American Heritage Month, and we would like to recognize them. Despite these things, they've persevered, preserving their identities, protecting sacred lands, and advocating for justice. So today, Native leaders are shaping things like policy, education, healthcare, and environmental practices, not just for their communities, but for all of Nevadans. As we reflect on this month, please let us also commit to learning more, listening more deeply, and in standing in solidarity with our Native communities. And while Native American Heritage Month officially concludes on November 30th, the celebration of Indigenous culture does continue. So I would love to encourage you to attend any upcoming events that you may have in your area or virtually that honor these Native voices and their traditions that are so rich within our state. NOMHE sourced information from the Department of Native American Affairs, resharing in an e-blast to the contact log for over 600 individuals. If you're not receiving such information related to kind of this month of observance, please provide your name, your email, and a request to be added to the distribution list in the chat box. NOMHE does an incredible job, their staff setting out this information, making folks aware of kind of what's going on with regard to things like observances and public health issues and even events that they're working on. So if you're not on that list, it's a great one to be on. In addition to recognizing the Native American Heritage Month, we'd also like to recognize Rural Health Awareness Month is also in November. So with that said, Nevada is often recognized for the sprawling distribution of its population, a significant percentage of which finds itself as rural, and we have a lot of frontier communities as well. Services, policies, and entities like our own here with NOMHE are becoming increasingly aware of disparities that residents of these areas may experience and are proactively working to support their unique needs, and in doing so in really creative and impactful ways. So with that said, one of the things that's happening is the University of Nevada, Reno School of Medicine, UNR Med, the Nevada State Office of Rural Health, Nevada Rural Hospital Partners, NRHP, and the Kirk Kerkorian School of Medicine at UNLV will all come together on the 20th of this month to celebrate this National Rural Health Day. As part of the workforce development focused itinerary, Dr. Ted McDonald, an obstetrics and gynecology specialist who's made a notable impact on public health across rural Nevada, will receive the 2025 Community Star. This event is scheduled for 1 to 5 p.m. At 4001 South Virginia Street in Reno. So if you are available at that time and if you are present, please go ahead and attend. It looks like our colleague here, Alex, has dropped that information in the chat box. So if you would like to register for that, please do so. It'll be a wonderful event, and there's a lot of folks that are participating in that, whether that's community organizations or even just community members as well. In addition to that, many of you are aware of the recently federally funded Rural Health Transformation, or RHT, grant. So the Nevada Health Authority has also submitted an application and wanted to talk about this a little bit as well. So the Nevada's application outlines a bold and strategic vision for transforming rural health care across the state with 4 different key initiatives. The first being Rural Health Outcomes Accelerator Program. So this is a $30 million proposed annual investment in value-based and innovative care models to better provide and manage chronic disease. The second is a flex fund for rural providers. This proposes a $40 million annually aimed at modernizing rural health infrastructure, including technology, mobile units, and even emergency services. Workforce recruitment and rural access program is the third portion. This slates about $80 million annually to work to address health provider shortages so needed through incentives, tuition aid, and rural residency programs with a 5-year rural service commitment. And then finally, rural health innovation and technology grants. This final portion projects $30 million annually to enhance rural telehealth, cybersecurity, and health data systems aligned with CMS's digital health ecosystem. Award announcements will be made before the end of 2025. And a public workshop will be held in January to further discuss these major initiatives and also propose funding distribution plan for that RHT grant award. So for more information, NOMHE staff will drop a link in the chat box. I believe we also have here a QR code that you can use if you would like to access that as well. But if you don't have access to that QR code for whatever reason, I'll go ahead and I'll read off the link here as well. So that's that link is NV.nv.gov/community/rural_health_transformation. So please go ahead and follow that link or that QR code to find more information about that as this kind of evolves. And then another observance that I'd like to kind of mention here as well is that November is also Homeless Youth Awareness Month. So with that said, I'm pleased to share a new resource here. And it looks like it's up here on the screen as well, the Southern Nevada Youth Resource Guide. So NOMHE staff will have a hyperlink as well, and I will also share this link. With that said, the guide was produced by Project Real NV. It's a youth-focused Southern Nevada nonprofit educating grades 3 through 12 on legal and civic-oriented experiences. And this was in collaboration with the City of Las Vegas and funded by the Edward J. Byrne Justice Assistance Grant. Resources are identified to benefit individuals between ages 12 to 25. And the guide is filled with a wide range of helpful resources ranging from housing to health and legal education needs and so much more. So please take a look at that when you get a chance. It sounds like we're dropping that in the chat box, but I'll once again also read the link here. So that link is going to be projectrealnv.org/SNYRJ. So please take a look at that when you have a chance. This is an immensely important and really thought out and well-produced resource. So please take a look at this if this is relevant to your organization or as a community member as well. This is a really important issue. And it looks like, yes, Alex is dropping some more information there in the chat box. And then finally, rather than delving a little bit more into all of these, there's a lot of awareness kind of happening this month as well. But chronic disease is something that's incredibly important as we look to benefit the public health of our state. There's a few different occurrences this month in terms of awareness as well. So this month is also COPD Awareness Month, Diabetes Awareness Month, Epilepsy Awareness Month, Lung Cancer Awareness Month, Pancreatic Cancer Awareness Month, and then finally, another important one, Mental Health Awareness Month, or Men's Health Awareness Month, rather. So a few different occurrences kind of happening this month. If you haven't kind of delved into maybe a few of these areas of awareness, I would really encourage you to do so, whether it be community events or maybe even with folks around you that are experiencing some of these things. And then finally, just additional heritage awareness categories that are happening kind of this month would be Trans Day of Remembrance happening on November 20th. And we're also currently in Hawaiian New Year, which runs over 4 lunar months, October to November, and then February through March as well. So with that said, I know it was a bit of a lengthy introduction, but wanted to recognize all of these immensely important months of awareness, resources that have been put out by respectful and really well organized organizations. And then in addition to that, just kind of recognizing a couple of chronic disease awareness months as well. I do see a hand raise. Ms. Tiara Flynn, did you have a comment, question?
Just wanted to add a comment to the awareness days. This is Tiara Flynn, committee member for the record. It's also International Adoption Awareness Month. And then as an extension from October being Domestic Violence Awareness, there is Elimination of Violence Against Women Day, which is November 25th.
Thank you so much, Ms. Flynn, for those additional days of awareness. With all of these things kind of happening, it's incredibly important to remain engaged, be aware of these issues. And Ms. Flynn, thank you so much for contributing additional points to the conversation there. With that said, we'll go ahead and we'll move on to the second point in our agenda here. And it's really our practice to kind of rotate the reading of our land acknowledgement. So reading today's land acknowledgement would be Dr. Andrew Thomas Reyes. Would you please present the acknowledgement for today, Dr. Reyes?
Yes, thank you, Dr. Andrew Reyes, for the record, a committee member. Land acknowledgement. The Office of Minority Health and Equity, as a program of the Nevada Department of Human Services, acknowledges, honors, and respects the diverse indigenous peoples connected to this land and recognize the state of Nevada is situated on the traditional homelands of the Nuwu, Newe, Numu, and Washishu. We offer gratitude for the land itself, for those who have stewarded for it for generations, and for the opportunity to work alongside our tribal partners. We encourage everyone in this space to engage in acknowledgement and continued learning about the indigenous peoples who work and live on this land since time immemorial and about the historical and present realities of colonialism.
Thank you so much, Dr. Reyes. With that said, we'll go ahead and move on to our third agenda item here. This will be public comments. So with that said, I'll go ahead and I will read the acknowledgement here. And please feel free to chime in thereafter. So with that said, public comment will be taken during this agenda item. No action may be taken on a matter raised under this item until that matter is included on an agenda as an agenda item for which action may be taken. The chair of the Advisory Committee on Minority Health and Equity will place a 2-minute time limit on time individuals may address the committee. The chair may elect to allow public comment on a specific agenda item when that item is being considered. To provide public comment telephonically, please dial 1-775-321-6111 anytime after I've announced this period of public comment. When prompted to provide the meeting ID, please enter 701-302-51#. With that said, I will go ahead and open it up to public comments. If you are on the call virtually here, please feel free to raise your hand. And we will recognize you as you come in. And then again, if you are dialing in, please do so and then provide that meeting ID. I'm currently seeing no hands raised. Do we have any folks that I may be missing, or maybe folks reaching out telephonically?
Mr. Chair, at this time, no one has their hand raised and no one has joined the call via phone.
Thank you so much, Alex. With that said, we've given it a couple moments here. It looks like we have no public comments at this moment. You will have another opportunity towards the end of the meeting to provide a public comment. So if thoughts arise in the interim, or if you would like to provide them at that later time, you will have one more opportunity to do so. With that said, we will go ahead and move on to our next agenda item here, agenda item 4. For all of the advisory committee members that are here on the call, you were provided a copy of the August 12th, our in-person meeting minutes, and they were posted on NOMHE's website as required by statute. So with that said, you should have received these as well as reviewed them for any potential changes. With that said, I'd like to go ahead and ask if we've taken a look at those, and also for a motion to approve if there aren't any changes. So first and foremost, please let us know if there were any changes that you would desire on that. And if not, we would like to ask for a motion to approve.
This is Bishop Bonnie Rad, I make a motion to approve those minutes.
Thank you so much, Bishop Bonnie Radden, for that motion to approve the meeting minutes. Do I hear a second?
This is Andrew Wilson.
Second.
Go ahead.
We had a couple there. Ms. Wilson, I believe I heard you chime in as well. So Andrew Wilson, I'm hearing a second from you. With that said, we will go ahead and we'll move on to if there are any discussion ahead of making a motion to accept these changes. Would we like to have any discussion before we move to a vote? Hearing or seeing none. All right, with that said, please all in favor, please say aye.
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 All opposed, please say nay. Hearing or seeing no opposition here, the motion carries. So with that said, a link of the full recording of that meeting will be added to the NOMHE website to augment the written minutes. So this will be placed on the website, a beautiful new website that they've got kind of set up there. So with that said, we will go ahead and turn our agenda item to agenda item number 5, which serves to inform the advisory committee members of NOMHE sustainability status with our beautiful new version. So Ms. Dorch, would you please proceed in providing this information?
Thank you, Mr. Chair. This is Tina Dorch for the record, and I appreciate your recognition of the work the team put into the new web page and the reformatting of our budget. To that point, our budget is an informational item on the agenda, and I share it per the statute that in itself is meant to inform our advisory committee members of NOMHE sustainability status. And it's also meant to serve as an aid to our advisors so that in your statutory duty to review our use of appropriated dollars, you're able to then better make informed recommendations regarding the activities of the office. So having said that, you see a slide there. The slide is a reflection of the report that was reconciled through October 30th of this year. And today's reconciliation, I'm happy to say, reflects that we now have 2 revenue streams that are coming into the office. We have our standard funds for a healthy Nevada dollars that are appropriated through the state, but we also have a new grant with the Nevada Department of Public Safety. Each quarter, we update and let you know about these sources. We're excited to say that the relationship with the Nevada Department of Public Safety's Office of Traffic Safety in particular is what resulted in that additional grant. We were able to encumber those dollars through the October IFC meeting, and we are now fully engaged through contract. Activities began in July, and so we've been billing now retroactive to July. And later in today's agenda, you're going to hear from the one NOMHE staff person who's assigned to work on the Vulnerable Road User Initiative that's related to the grant. For those who don't know, the funding fiscal year for the state is July 1 through 2025 through June 30th of next year. And so we just like to make sure people understand that that's what these dollars reflect. The original award for this particular fiscal year was $442,867. and that is split across our FTE personnel. That's $132,852. And then the balance of that amount is for operating expenses. And those operating expenses reflect the cost to keep employed NOMHE's 3 other contractual staff persons. As of October 30th, we've extended $153,891 and some change. And this does reflect, I'm happy to say, the hard work of our ASOs, Administrative Service Officers, or fiscal folk. This reflects all their year-end activities. So we are now up to date on chargebacks, our personnel-related expenses and transfers between budget authorities. These have all been brought up to date through their reconciliation processes. We have a balance as of October 30th of $288,975. And we're projecting between now and the end of June of next year to expend $250,829. And that will leave us, we project, at the end of June 30th, 2026, with a balance of $38,145. So with that being said, Mr. Chair, we're well positioned to cover any necessary expenditures, as well as, the anticipated travel that this body joins with us to travel for our Northern Nevada meeting. So I'd like to just say that we remain good stewards of our budget. And this does conclude my quarterly presentation. And if there are any questions, Mr. Chair, or to other members, I can answer them.
Thank you so much, Ms. Dorsch, for the presentation of the budget and on all of the information therein. Are there any other questions, maybe comments by any of the advisory committee members at this time? Hearing or seeing none. Ahead of shifting over to the next agenda item, just wanted to commend you as well, Ms. Dorch, you and your staff for continuing to do the great work that you're doing with the funds that you have allocated to you. It looks like you're doing an incredible job, and I'm looking forward to hearing more when we jump into these next updates here.
Yes, Mr. Chair, if you'd like me to move into agenda item number 6, I can do so.
Please proceed.
Thank you. Again, this is Tina Dorch for the record. And this is the agenda item where we let our advisors know the work we've done since we've last met. And we strive to keep the public and the advisors up to date on these activities. And so regarding the first presentation, our team is made up of 2 full-time employees, myself and Ms. Karina Fox. We've now modified, Mr. Chair, our quarterly agendas to allow time for Ms. Fox to update us twice a year. So today will be the first time. And in contrast to her future presentations, today she's going to spend time updating you on what her position does with a broad overview of its function and focus. So Mrs. Fox, if you don't mind taking over.
Good morning, Chair, Advisory Committee, and everyone.
Ms. Fox, we can hear you, but it's a little quiet.
Okay, let me, hold on.
That sounds a little better.
Raise the volume a little bit. Okay. Good morning again, Chair and members of the Advisory Committee. Thank you for the opportunity to provide an update of my role, the Health Program Specialist 1. The intent of my presentation today is to increase transparency and to keep the Advisory Committee informed of activities and ensure that you remain fully informed on NOMHE's statewide efforts. These updates also reinforce coordinated planning across agencies and emphasize the importance of keeping minority and underserved population centered in Nevada's public health infrastructure. Next slide. I'm sorry. Can we go back to the purpose? Sorry. This standing update support 3 core goals. promoting open communication and visibility into NOMHE's ongoing activities, and strengthening alignment with state-level public health priorities and partner initiatives, and ensuring that community voices, including the voices of rural, tribal, minority, and otherwise underserved populations, continue to shape system-wide planning and decision-making. Next slide, please. My work spans across 9 major areas of the statewide public health infrastructure, and these include chronic disease prevention and management, infectious disease support, including HIV and hepatitis, behavioral and mental health, maternal and child health, aging, elder support, independent living, disability and senior support programming, rural and tribal community engagement, and others. Each of these areas represent a critical access point where inequity can occur. My role is to monitor these domains, participate in statewide planning, and help ensure that population experiencing barriers are considered in program design and implementation. Next slide, please. A central component of my role is amplifying Nevada's capacity to support population facing barriers to care. These include ongoing alignments with statewide frameworks such as the Silver State Health Improvement Plan, also known as the HHIP or SHIP, and community health assessments. We also continue to incorporate priorities identified directly by tribal health partners, as well as statewide findings related to access to care, social support gaps, and technical assistance needs. These alignments ensure that NOMHE's contributions are not siloed, but strategically positioned within the Nevada public health system. Next slide, please. My role involves active participation across multiple statewide committees, councils, and technical work groups. This platform allows us to identify emerging needs, share resources, and amplify cross-sector relationships. This participation includes in the Indian Education Advisory Committee, monthly tribal liaison meetings, the Food Advisory Council, the Southern Nevada Food Council, and the CHIP Steering Committee. Also, I support statewide partners through initiatives such as Hope Mid Nevada, the statewide cardiovascular work group, and the Maternal Advisory Committee. I also serve on the Minority Interagency Collaborative, also known as MIC, which we develop an annual report and is in today's agenda. The Nevada Healthcare Workforce and Pipeline Development Work Group, the Primary Care Work Group, coordinated engagement with the Department of Native American Affairs Commissioners, and ensuring tribal-specific issues are elevated and incorporated into state-level discussion. I also participate in the Childhood Lead Poisoning Prevention Program, emergency preparedness efforts, the chronic disease work groups, and statewide food security forums and conferences. This collaborative engagement improves alignments between Community Health Improvement Plan, Silver State Health Improvement Plan, and the Workforce Pipeline Development Plan, promoting consistency and structured statewide coordination. My primary relationships at this point include tribal health leaders, Department of Health and Human Services Division, such as the Office of Analytics, whom we collaborate in data requests, monitoring, and population-level analysis, the Governor's Office, where we have now established clear communication, points of contacts, and semi-annual coordination touch points. Local health authorities who identify regional level needs and opportunities for alignment, community-based organizations, many of whom we serve minority populations directly, and higher education partners and workforce boards. Maintaining partnerships that NOMHE's board remains informed, coordinated, and connected across a statewide system. Next slide, please. Now, this one is going to be a bit of information, and I just would like to clarify a few of these plans. I know it seems like quite a bit, but just let me go over them and maybe we'll understand that a little better. Nevada operates under 3 complementary but distinct statewide frameworks that guide public health improvements. Community Health Improvement Plan, also known as the CHIP, the Silver State Health Improvement Plan, also known as the SHIP, and the Works by Pipeline Development Plan. Each serves a different local purpose, statewide strategy, and workforce sustainability, but all work together to strengthen Nevada's overall public health infrastructure. Now let me go over the Community Health Improvement Plan, also known as CHIP. The primary purpose of the CHIP is the community-driven assessment and action plan for Southern Nevada. It identifies urgent health issues, community strengths, and priority areas using the MAP 2.0 framework. It focuses heavily on health inequities, social determinants, and community conditions. The outcomes and initiatives using the Hanlon scoring method, the top priority areas for 2025-2030 were selected, and these are access to care, chronic disease, and public funding. The CHIP outcomes build the foundation for programming and planning in the next 5-year cycle. The lead entities are Southern Nevada Health District, which is supported by local health authorities such as NOMHE and 20+ organizations in the steering committee, such as the American Heart Association, Puentes, Duro, UNLV, and others. The CHIP tells us what the community needs most and identifies the priority health areas we must address at the local level. Now, going over the Silver State Health Improvement Plan, SHIP. This one is running to 2023-2028, and the SHIP is the statewide strategic plan. It provides the big picture vision for public health improvement across all Nevada communities. It sets statewide goals, shared performance, measurements, and alignments across agencies. Excuse me. The outcomes and initiatives align priorities, agencies, and systems, establishes statewide performances indicators, integrates equity, infrastructure modernization, and cross-agency collaboration into all strategic objectives. The lead entities of the SHIP is the Division of Public Health and Behavioral Health, also known as the PBH. In partnership with the Public Health Resource Officer from the Governor's Office and supported by multi-agency teams statewide. While the CHIP tells us what is the local need, the SHIP provides a statewide roadmap. It ensures every agency is working towards the same shared goals. Now, going over the Workforce Pipeline Development Plan. The primary purpose of this focuses on strengthening, amplifying, and sustaining Nevada's public health and healthcare workforce. It supports recruitment, training, and retention initiatives. The outcomes and initiatives develops long-term training pipelines, recruitment pathways, and retention initiatives. Promoting workforce diversity, especially in underserved communities. Building partnership with universities, HRSA program, and field training sites. The lead entities on these ones is the TPVH Office of State Public Health Infrastructure, Training and Preparedness, in collaboration with HRSA, academic institution, and NOMHE. The WPDP ensures we have the workforce capacity needed to execute both the SHIP, the SHIP, and the CHIP. Without people, none of the plans can move forward. In summary, these 3 frameworks operate at different levels, but they're all interconnected. The CHIP identifies local needs. The SHIP set a statewide strategy. And the WPDP ensures we have the workforce to carry it all out. Together, they create a comprehensive structure to improve health outcomes for every Nevada. Next slide, please. These activities ensure that my work is both strategic and responsive, grounding NOMHE's work and role across a statewide system. The formalization of NOMHE's priority areas through a statewide mapping and matrix alignment, which is what I have worked on. Coordination of stakeholder meetings across state agencies to improve communication and identify system gaps. Key informal discussion with state partners and community organizations to refine needs and confirm priorities. Institutionalized semi-annual engagement with the governor's public health resource officer, enabling high-level alignment on statewide and strategic priorities. Through this process, I identified the four major activities that now guide my work. I introduced these categories in the previous slide, and each one of these reflects a strategic alignment, statewide planning needs, and community input. One of the ongoing core functions of my position is coordination. This includes coordinating across division, work groups, tribal partners, and statewide advisory bodies. Many of the efforts we have discussed today, from stakeholder engagement to legislative support to alignment with statewide plans, require a coordinated approach. My role is to ensure that NOMHEs remain connected across the platforms, that information flows consistent, and that minority health priorities are represented during planning and decision making. Next slide, please. Our last meeting, we have shared that we were in the recruitment phase for several appointments for the Advisory Committee for Resilient Nevada, also known as ACRN. Now, I'm pleased to report that the recruitment responsibilities assigned to NOMHE have been completed. This includes outreach, candidate vetting, partnership coordination, and ensuring diverse representation in the applicant pool. Excuse me. This work directly contribute to amplifying representation on the Advisory Committee for a Resilient Nevada and supported equitable participation in opioid-settled governance. A key component of this role involves policy and legislative readiness. During this period, I have tracked equity-related legislation aligned with the 9 focus areas and supported policy reviews to prepare for the 2027 session. I've conducted outreach and recruitment for the Advisory Committee, as I said before, ACRN, with an emphasis on diverse representation. Supported coordination with diversity and inclusion liaison across the agency, as you already know, which the MIC Intercollaborative Group, which we will also be seeing today with the DIL annual report, also known as Diversity Inclusion Liaisons. Monitor interim committees to identify emerging policy impacts that may affect minority population or service accessibility. And the outcomes have included strengthening minority representation in opioid settlement governance process, and identifying structural barriers in Nevada's public health infrastructure that impact minority populations, and increasing visibility and awareness of critical state resources such as the 988 Suicide and Crisis Lifeline. Next slide, please. Sorry, my slides are glitching. One second. There it is. Continuing in the upcoming quarter, I will continue advancing several priorities. Deepening the strengthened matrix alignment engagement, excuse me, and enhancing documentation across statewide partners. Supporting integration of Silver State Health Improvement Plan, Community Health Improvement Plan, and workforce development initiatives to ensure alignments across programs. Preparing policy brief updates related to the 9 focus areas. Resource tools and legislative references trackers as needed. Formalizing a biannual communication cadence with the Governor's Office to support statewide coordination and enhance information flow. These efforts are all intended to sustain a structure, collaboration, and ensure readiness for a common policy cycles and statewide planning. Next slide, please. I want to take a moment to highlight the essential role of this advisory committee. We welcome your continued feedback on prioritized areas impacting your communities, emergency trends or concerns that NOMHE should monitor, potential partners, organization, or data sources to amplify our work, opportunities for NOMHE to amplify community voices or support community-driven initiatives. Your expertise ensure that NOMHE's work remains responsive, grounded, and community-informed. Next slide, please. If you have any questions, I'm happy to answer anything that you have come up with and provide additional detail on any areas of today's presentation. And thank you for your time and ongoing partnership. I appreciate the opportunity to provide this update and remain committed to supporting the statewide vision for a healthier and more accessible Nevada. Next slide. And throughout this course of work, and especially during this committee meeting, I rely on several acronyms tied to statewide plans, work groups, and legislative language. So to support and clarify the Q&A, I included a full list of acronyms in this slide. If you have any questions, I welcome them. Thank you.
Thank you so much for your presentation, Ms. Fox. Very informative and a lot of really great work that you're doing. At this time, I'd like to open it up for advisory committee members for questions or comments. Please proceed with any questions or comments that you have.
So Bishop Bonnie Radden, great work. Wow. That's all I can say. Wow. So thank you. Thank you. And thank you, Ms. Dortch, for the incredible work you do there in the office.
Thank you so much, Bishop Bonnie Radden. Additional questions or comments, please feel free to proceed.
Andrew Reyes, committee member for the record, asking. So first of all, I'd like to acknowledge this. This is an enormous amount of work, and thank you very much, Ms. Dortch and Ms. Fox, for your efforts and successful efforts and work and tremendous efforts you have done in forwarding the health of minority health. My question is more on the three frameworks you showed, Ms. Fox. Is any of those systems, the CHIP, the SSHIP, are they involved with the upcoming Rural Health Transformation Grant?
Yes, they are all involved in one way or another. Many agencies are all interconnected with these plans. And for example, there is an annual conference coming for the food conferences, which is going to be on Northern Nevada, which touches on, tribal and rural needs, as well as the Indian Education Committee on tribal needs. Then you also have the CHIP Community Health Need Assessment Plans. We're all working together to make sure that the community is also interconnected. There is one specific, I can't remember the date, but there is one specific conference that is coming up with diabetes and chronic disease needs. So that are all interconnected with rural and health needs. So yes, to answer your question, in short, they're all working towards that goal.
Okay, thank you.
I can go ahead and ask another question here. Oh, Mrs. Dortch, it looks like your hand was raised as well.
Yes, thank you. For the record, Tina Dortch, and I just wanted to just add to Karina's response to that. Dr. Reyes, if you recall, our chair kind of outlined the 4 key initiatives that are going to be part of the state's award And one of those areas that they're going to be working on is the Workforce Recruitment and Rural Access Program. So I would say, as Karina said, there is a direct correlation between that particular set of deliverables and the ones in the workforce pipeline plan that she mentioned. That has already laid some groundwork. So should we be awarded that component of our HT grant, I think they would find it very beneficial, Dr. Reyes, to circle back to the workforce plan. And we are attending that January meeting. We've attended past meetings that are to keep the public up to date on the application. And we will continue to share these resources, especially after the award has been announced.
Thank you so much, Ms. George, for the additional context there. Nick Dunkel here for the record. Sorry, I'm noticing our interpreters are switching slots, so I want to give them a second. Oh, sorry, maybe I'm missing cues there. I'm just seeing both spotlighted. Anyway, so I just wanted to jump in to ask a quick question about the chip. You mentioned that it is based upon the MAP 2.0 framework in terms of the development of it. Would you be able to share a little bit more information as to what that framework is and kind of how the information is developed based upon that framework?
On the CHIP, is that what you're saying?
Yes, you mentioned it was based on the MAP 2.0 framework.
Yes. I'm sorry, what was your question again?
Oh, sorry. So you mentioned it was based upon the MAP 2.0 framework for kind of developing the chip. Could you provide more context as to what that means and how that framework was used?
Specifically, no, I cannot tell you exactly how did they come up exactly with the need of the framework and how it was assessed. Also with the Halen method, I do believe that with the Halen scoring method, that's how they come up with everything. But and there is a system listed, but I couldn't explain you exactly how do they specifically where to come and use the MAP 2.0 framework to examine the health needs.
No worries, no worries. Just curious as to kind of how the framework is used to give more context to how the information comes about related to the health inequities.
It's a little bit technical, yes.
Yeah, no worries. And then I just had another quick question here too. Amidst some of the information on that final slide for how advisory committee members could provide support, I know you mentioned one of the things was kind of providing additional potential areas for looking into or potential additional groups. It looks like you're doing a lot of work though. So how do we do so without adding too much to your plate, or are there specific areas that you maybe want to branch out to?
No, I am open to looking up specifically to potential partners and organizations just to amplify NOMHE's work. So whatever emerging needs comes up or concerns that a specific population has or the advisory committee wants to bring up, I am open to deep into that area and just focus my area and time into that specific. So it's not like I'm not open or I don't have enough time. So if you have any potential partners that you want to bring up or data sources or in a specific population or trend that you want me to work on or look up, I am open to look into that.
Awesome. Yeah, no, it looks like you're doing an immense amount of work. I really appreciate all of the work that you're doing. Nick Dunkel, once again, for the record. I really appreciate all the work that you're doing. I'm seeing work here, whether it relates to community health improvements at the state level. You mentioned rural involvement, and then also the workforce initiatives as well. I think that with all of those things combined, this can be really impactful. And you're wearing a lot of hats, so I really appreciate the work that you're doing here and being involved with all of these different groups. I echo Bishop Bonnie Radden's statement of just wow. There's a ton of work that you're doing, so we really appreciate the work that you're doing there. And thank you, Ms. George, for sharing additional information there in the chat. And thank you again for the acronym list too. I know that that's something that can be a little bit confusing when it comes to a lot of these public health initiatives, and you're doing a lot of work. So thank you so much for providing that additional context. With that said, I did want to open it up to any additional questions that advisory committee members had, or maybe comments. Please feel free to jump in ahead of our next agenda item.
Yes, our next
And
agenda item is going to be Ms. Alexandra Neal. And as I mentioned during the budget review, she has a new initiative that is funded through the Department of Public Safety's Office of Traffic Safety. And she's here to give us again, kind of a global overview of what this initiative is and does. And and has taken place since July. Go ahead, Ms. Neal. Alex, if you're speaking, we can't hear you.
Oh, sorry. I was saying good morning, and then I just said 1 second while I switch the interpreter spotlight. Sorry. Can you hear me okay now?
Yes, we can.
Okay, great. Awesome. So I am, just for reference for anyone who is not aware, although all of our advisory committee members are at this point, is I'm Alex Neal, management analyst 2 with NOMHE, and I'm working on the Vulnerable Road User Initiative update. So what is the NOMHE's Vulnerable Road User Initiative? This initiative is a part of a subgrant that the office was awarded to work on a traffic safety program through the Department of Public Safety's Office of Traffic Safety and the Nevada Department of Transportation. Specifically, what we're focused on is supporting what we're focused on and what this award does is to support development and implementation of efforts that promote inclusive safety protocols for vulnerable road users through analysis, multidisciplinary collaboration, health literacy projects, and community engagement. It is focused on the counties Carson, Clark, and Washoe County, so to more focused towards our urban core at this point in time. You might be asking yourself, why NOMHE? Well, NOMHE is structurally and missionally aligned to address social determinants that influence whole wellness. And the profile of a vulnerable road user is shaped not only by how people travel, whether that's through walking, biking, or other mobility aids, but also through overlapping demographic and geographic factors such as age, ability, income level, race, ethnicity, and proximity to high-risk traffic zones. So it really aligns with our NRS 232 and it really aligns with our Nevada revised statutes under Chapter 232, where we are looking at a multitude of factors, including some of which that are named on the slide. So I'm going to go over some background information and provide some details and just a little bit of education on public safety, traffic safety, and what a vulnerable road user is, because you may or may not be familiar with that term. So a few things I would like for you to keep in mind today as I provide this brief overview is that in this framework, we are thinking of health as the state of complete physical, mental, emotional, and social well-being, as well, and counter to that, not counter, but adjacent to that, we're thinking of public health as an industry or a programmatic focus on promoting and protecting the health of a community through short, intermediate, and long-term systematic solutions. Related is public safety. So public safety feeds into public health and it feeds into our overall health and wellness. And what I would really like you to do is to think of health as, think of public safety as a sense of physical, emotional, social, and material security that fosters stability and is accompanied by support from your community and society when needed. And adjacent to public safety and an integral part of traffic safety is also emergency medical services. So emergency medical services, or EMS, is when our individual health, our physical health, is really being addressed through urgent or emergent treatment for illness or injury that is critical to a time and place. I know that's a lot of definitions. I know I said that pretty quickly, but we just kind of want to touch upon that because it all relates to our overall initiative, goal, and focus. So what exactly is traffic safety? Traffic safety refers to the practices, policies, infrastructure, and behaviors aimed at preventing road users, like drivers, passengers, pedestrians, cyclists, and others from being injured or killed in traffic-related incidents. Well, then it also then brings up the question of like, well, how does that relate to the social determinants of health? Because you mentioned that earlier when you said what the project is focused on and why NOMHE. Well, a key component of, well, let me rewind. Social determinants of health, for anyone who is unaware, are the conditions that impact, or conditions and or factors that impact how we live, work, age, play, or worship. They are influenced by broader forces and how society is built and established. And these social determinants of health are split into 5 categories as identified by the United States Department of Health and Human Services and within our Healthy People 2030 goals. Healthy People 2030 are the goals established at each decade for improving the health and wellness of our nation. And that includes neighborhood and built environment, economic stability and access, neighborhood, education, access and quality, healthcare access and quality, and social and community context. And all of these play a role within traffic safety. Our neighborhood and built environment is how our roads and our neighborhoods are set up and how do we travel it. Economics, I think, is pretty self-explanatory, but how do we fund this travel? How do we fund how we move around? Education is a big component of that as well. Healthcare access and quality, education, and social and community context tend to be large reasons why we're traveling in the first place. We might be traveling because we want healthcare access. We might be traveling because we are trying to get to our job and make money to fund our lives. Or we might be traveling so that we can see our family and our friends and really build our community and build what we need to be social. And I just wanted to provide that context for anyone who is not aware about what the social determinants of health is, but also tie in how traffic safety and transportation goes in that as well. So then it brings us to political determinants of health, which is really important for our project because a portion of the project is focused on policy analysis. And so the political determinants of health are the political and social systems that influence the distribution of resources, opportunities, and power, ultimately affecting the health and opportunities of our communities. So, for example, when our policies, our laws, our regulations determine our funding structures, it also determines the priority areas of our government in terms of what we would like to work on. And then additionally, the Department of Transportation, the Department of Public Safety, and the Department of Human Services may identify needs in our work with the communities that we would then like to bring up to a policy level in order to promote wellness and increase the wellness of our communities. Which then brings us to the social determinants of transportation. So social determinants of transportation are those social, economic, and environmental conditions that influence how we all, and as individuals and communities, access and experience the transportation systems within the state of Nevada. Which takes us to one of our final definitions, which is, what is a vulnerable road user? Why are we focused on vulnerable road users? And what makes that different from us driving in your car every day or riding in a bus or things like that? Well, a vulnerable road user is someone who faces an elevated risk of injury or harm in traffic scenarios due to the absence of protective features typically found in vulnerable vehicles. The way I like to explain it in layman's terms is a vulnerable road user is anyone who can be hit by a vehicle. which then includes examples of pedestrians, bicyclists, or riders using a personal conveyance device or a micro-mobility device like a scooter, a skateboard, an e-bike, or even like if you're in a wheelchair, a motorized wheelchair, things like that. So, and even like workers in work zones. And so we really wanted to focus on this area, and Office of Traffic Safety wanted to focus on this area because transportation decisions affect everyone. Transportation decisions, the infrastructure, all of this influences where we live, how our communities get to work and school, how easily they can access health and other essential services, how they socialize, and ultimately how we all thrive in the environment that we reside. Public safety, transportation decisions, and traffic safety are all public health. They're all a part of public health. They're just really, really big things to take on, and therefore they have their own departments and own dedicated staff to focus on that. And with this in mind, we focus on vulnerable road users because vulnerable road users don't have certain protections that you would in a car. Cars have been built to, at this point in time, to withstand damage wherever they can, right? And our bodies don't have that same protection. So that's just one thing that we want to make note of. So going to the actual details of this vulnerable road user project. It is split into 5 phases. These phases do overlap, but these are the categories in which all of our work in this project will fall under. So there's a literature review and policy analysis. The literature review was just completed. I may or may not be adding additional information as I learn new things though. Then there's policy analysis, which is mostly completed, but it is slightly ongoing, especially in light of like the special session has a current traffic safety bill focused towards school zones right now. That's something that I'm just keeping track of, et cetera. We have community and government engagement. Under that community and government engagement, our office / I will be facilitating inclusive engagement through World Cafe sessions, listening sessions, and partner insight meetings, key informant meetings, and all different sorts in all 3 of the counties that I mentioned earlier. And this is going to be based on community-based participatory principles, and which then leads us into intersectoral integration. So one of our primary goals is to promote alignment between traffic safety and community wellness through shared strategies and messaging. So our office will be creating some messaging, we'll be creating some educational products, but we'll also be taking the information gathered through those sessions and our community and government engagement to really narrow down appropriate strategies and also make recommendations to that fact. So a final report that will be available at the end of our grant period in September 2026, September 30th, 2026. As a part of that, we are also engaging in education and capacity building through events by giving input into awareness campaigns, by considering developing awareness campaigns ourselves, as well as helping with planning of the different events and activities such as the annual traffic safety symposium or conference. You may guys have remembered seeing some e-blasts from us about inviting you to attend, which also helps to sustain the collaborative development phase of our project. That collaborative development phase is focused specifically on augmenting an existing sustainable and multi-sectoral initiative to support long-term policy and behavioral change, and really highlighting the intersectoral engagement of pulling in not only traffic safety professionals, but also public health professionals and community members. A review of our activities that we will be doing, as well as activities in the past. I provided input into the 2026 State Highway Safety Plan draft that is set up for, it's in its last revisions and approval now, and so that it can begin implementation January 1st, 2026. NOMHE participated in the Zero Fatalities Annual Traffic Safety Summit. This is our second year planning a session in this summit and second year planning, being a part of the planning committee for this summit. But this is the first year that the traffic safety, the Office of Traffic Safety team and the Kimley Horn team very graciously let us plan 2 sessions and moderate 3. So that was pretty exciting. And that was really cool because I just want to highlight Dr. Hickson, even though he was unable to be on the call today, because one of the speakers for the sessions moderated by the NOMHE team was Dr. Hickson and his colleague, Sarita. They discussed behaviors that are commonly seen with distracted drivers and things of that nature. And it was actually a really, really cool experience. And so if you guys ever have a chance to engage with our vice chair, Dr. Samuel Hickson, and ask him more about the information and the research that they were doing into that, it was very enlightening overall. I also participated in a grant review as well as the literature review, which I mentioned earlier. Continuing policy analysis, upcoming, we have product development, our partner insight meetings, listening sessions, and those partner insight meetings, those listening sessions, and the World Cafe sessions that will come in the spring are all going towards an overall root cause analysis. And that root cause analysis and the results of everything that we're doing will be included in a report, like I stated earlier. Additionally, we are incorporating traffic safety priorities, initiatives, and education thoroughly into our general outreach activities. So don't be surprised if you hear more about that in that way. So on our next slide, I'll just click. Okay. On our next slide, I just wanted to highlight one of the other things that we are doing, which is collaborating with the UNLV School of Public Health, Max Gock and Courtney Kalkner. I never can pronounce her last name right. I apologize in advance. Okay. Where they are working on a vulnerable road user project, also funded through the Office of Traffic Safety, that utilizes the infrastructure of a Healthy Living Project scoping tool created by the UNLV School of Public Health and resides on currently the RTCS Nevada website. The overall goal of that project is to enhance traffic safety by improving the built environment and ultimately traffic-related behavior in Nevada's major urban areas. I apologize in advance because I don't know where my 3 steps are. But overall, this project, it focuses on assessing current needs of communities, assessing the area's existing infrastructure, and providing infrastructure recommendations to the Office of Traffic Safety. Okay, sorry. I'm pausing for a second because we are interpreter switching. Awesome. Thank you, guys. I'm just sorry to everyone, I'm multitasking in today's meeting. So that actually takes us to the end of my summary with 1 minute, slightly over my time. So here are the acronyms that I mentioned earlier. All of government tends to be alphabet soup. I apologize in advance. I do try to explain what these words mean as we go throughout. Just like Karina will be providing updates, I will be providing updates as the grant goes forward to the advisory committee about what is going on. And I am available at any time for questions, comments, or concerns. Please do not be surprised, especially advisory committee members, if I reach out to you guys individually regarding this initiative, just to ask questions or feedback, or even ask you to be a community member who provides insight. Here's my contact information for anyone who needs it, and I am available for any questions.
Thank you so much, Ms. Neal, for your really informative presentation and all the work that you're doing for this. Nick Knuckle, once again, for the record, please, any advisory committee members who have questions or comments, please feel free to chime in at this time. Seeing Bishop Bonnie Radden, please proceed.
Thank you so much, Bishop Bonnie Radden, for the record. I'm so incredibly grateful for this funding and this opportunity. I think that all of us have been aware of, number one, the things that have happened, particularly in our communities over the last year or since the school year, of our children who've been killed on our roads. Recently, last week, a road rage situation. I wanted to ask a question, and I know that you mentioned that there was a presentation by our vice chair. I was wondering if those notes might be available as a mental health professional and also as a pastor. And under your chart of saying, a key concept to keep, let's think that health is the state of complete physical, mental, and emotional and social well-being. And that social determinant of health right now for us is causing great stress in our world and strain on folks' mental and emotional well-being, which I think is seen in our roads. Just wondering a couple of questions. Number one, what might be coming up in the near future? Is there any way that I might be able to help? And as well, again, going back to the presentation that you said our vice chair, I was wondering if any of those notes might be available, or I can call him and ask him for them. Thank you so much.
No problem. I'm going to answer your last question first because I dropped a link in the chat. So on the Zero Fatalities website, which if you've not visited it before, it is Zero Fatalities, I want to say .org, but let me get, nope, .com. ZeroFataliesNV.com. So it's https://0 fataliesnv.com. It's tons of information on that. That is the state traffic safety website for the overall goal of zero fatalities on the road. In the link specifically, though, that I identified is for the 2025 sessions, and it includes all the presentations for the whole entire summit that were given. And so you're able to access the presentation slides there. Regarding like the notes and also additional information, I would recommend reaching out to Dr. Hickson because their presentation was about like a research project that they did. And so I think he would also have additional information. Going to your first question, and I'm just going to repeat back what I remember, and then you can let me know if I have it incorrectly. What I heard / remember was you were asking what, in terms of behavioral mental health support or education initiatives, things related to traffic safety exist, and then outside of that, what may you be able to do or help contribute to? Is that correct? Okay, I'm seeing head nod. Okay.
Sorry,
awesome.
That's correct.
No problem. I just wanted to make sure I answered the full scope of your question. So in terms of behavioral health and mental health, there are quite a few things going on. I'm just going to summarize and go in layers. So coming from the local level, but not government, not local municipality government, but rather our UNLV and UNR School of Medicine both have ongoing research projects focused around traffic safety currently. And I believe some of those projects do focus on behavioral health and mental health implications as well. I am totally happy to reach out to those teams to ask more information or at least find out the contact information and then get that to you, Bishop Radden. On the local municipality level, so this is city and county, I can tell you what's happened on the Clark and Washoe, and then I'll do Carson separate. So in Clark County, a lot of our initiatives are separated through Southern Nevada RTC, and then the 3 cities, Las Vegas, North Las Vegas, Henderson, and then also the county overall. All 5 of those agencies operate in conjunction and tangentially, and they should have their projects on their websites, but they have identified behavioral health and mental health as a concern. However, I am not aware of at this time of a specific project by one of those municipalities that has that as the major primary focus. Most of their focuses are in changing the infrastructure or increasing education on certain things. And when I say change infrastructure, it's like if you're in Southern Nevada, you're very aware with like the Charleston construction and things happening there. That's a 10-year project that has a lot of money going into it, where they're going to be revitalizing that whole entire street to make it more safe for people to walk and drive. And so there's some behavioral health, mental health components to that, but I wouldn't quite, regarding your question, I don't know if I would say that it is as much of a focus as you may want it to be. However, now is the time to engage and provide input because they're asking for it. Additionally, if you interact with any of the local law enforcement, they also are very engaged in this initiative as well. So that's just something where NOMHE is developing our relationships with our law enforcement agencies that includes Highway Patrol and all of the municipalities, City of North Las Vegas, City of Henderson, Las Vegas Metro Police, as well as Reno PD. We will just in the Washoe County and Carson City area, we're still working through that as well. And they mentioned behavioral health and mental health in conversations, but I would not be able to tell you specific projects at this point. For Washoe County, similarly, the local municipality has their own RTC initiative. And what's different is that Northern Nevada RTC does a lot of the projects, and versus the cities and counties in the South do a lot of the projects, and RTC is kind of overseeing, if that makes a difference, if that explains. I am still learning more about what Washoe County is doing, so I am happy to mark it down to identify what they may be doing in that space and related to behavioral health and mental health, so I can present on that the next time I do come and present to the advisory committee. For Carson City, I am still learning, because Carson City, if people aren't aware, is both a city and a county. It's kind of like Australia. That I'm still learning as well about how their traffic safety initiative goes. I will tell you that for the Nevada Department of Transportation on the state level and the Department of Public Safety, Office of Traffic Safety, they are very much focused on behavioral health and mental health. However, what they tend to do is sub-grant out to other initiatives. So for example, UMC Healthy Living Institute has a sub-grant from the Office of Traffic Safety. The Asian Community Development Council has a sub-grant from the Office of Traffic Safety. There's a whole list of others, so I can also find and collect that list and share that with the advisory committee if they're interested, or you, Bishop Radden, if you would like, and for the North and the South. Okay, did I answer your question fully? Okay.
Yes, thank you so much. And this is Bishop Bonnie Radden for the record. Thank you so much, and any of that information or any help that I can give, I'm really keyed into this at the moment, due to just the state of our world at the moment, and the folks who get out and get on the streets every day take their whole self, which includes their mental and emotional well-being or not well-being. So thank you.
No problem. I know that was a long answer, so I'll turn it back to you, Chair, and Ms. Dort.
No worries, no worries. Thank you so much, Ms. Neal, for your presentation. Incredibly informative. I don't have any questions, but just before we move on, wanted to commend you on your framing of the issue, moving from social determinants of health to political determinants of health to social determinants of transport. I think this is a presentation that could be delivered to the layperson, and the issue would be completely understood, and the work that you were doing would be completely understood. So I think ahead of moving on, I just wanted to commend you on your knowledge of the subject, and as well as your framing of it, because it's difficult work, to your point, and there's a lot of alphabet soup, but you've done incredible. So thank you for that. In the interest of time, I did want to turn it over to our program manager, Ms. Tina Dorch, for our next agenda item. So we have our outreach and health literacy updates with our program manager, Ms. Dorch. Please proceed.
Yes, thank you, Mr. Chair. This is Tina Dorch for the record. And as you mentioned, the last two presentations really were level setting, correct? They were intended to let the advisors and the public know that these are two activities, two program areas that NOMHE is involved in, to anchor people and what their focuses are. And in the future presentations, we'll be very more focused and specific on activities that are occurring as such. The next presentation is meant to be more reflective of how we engage at a community level, right? It's our outreach and engagement activities. And unfortunately, you have me, not Mr. Carlos Ramirez Gomez. He's on a much deserved vacation. I'm going to do my due diligence and my ardent best to pretend that I'm him and make it as entertaining yet informative as possible. So if you want to go ahead and move to the next slide, please. As you know, we are very much mobile and very present in the community, and this represents not the entire activities list that has happened since we last met, but just wanted to make sure that you understand that this community engagement that we undertake, it really does serve a purpose. And just in general, some of the 4 examples of how we engage with the community is under these brain health convening meetings that Carlos attends, partnerships for a healthy Nevada. They hold quarterly meetings. The Eco Madres Summit, that was a one-time meeting that Carlos participated in. And since our advisory committee in August, Carlos attended the Latino Network meeting. And this was hosted by the city of Las Vegas, where we were able to connect with Latino serving organizations to align efforts on culturally responsive health outreach. So all of these type of engagements, Mr. Chair, are meant to allow NOMHE to stay informed, to make sure we're sharing resources and that we're building trust with these diverse community stakeholders. And if you want to go to the next slide, please, you'll see other examples of that. On September 5th, there's an example where we were a part of the Nevada Hand activity. Nevada Hand is a leader in affordable housing in Southern Nevada. And on the 5th, we participated in a senior wellness festivity. This was an annual event, and it brought together approximately 500 low-income seniors. And we were part of a 40-person or 40-partner organization network who did health screenings and provided educational materials. And what's important about this organization is they also provide free transportation to those somewhat fragile and somewhat underserved seniors. And so that made one less barrier for them to overcome. So it was a really good event. Over 300 individuals attended that particular activity. The next activity is a pop-up event. On September 24th, Carlos represented NOMHE at this resource event that was hosted by the city of North Las Vegas at Tonaha Park. It was a very large-scale event, almost 600 individuals. And these were individuals who were primarily unhoused or in some form of crisis. And our primary focus there, Mr. Chair, was to promote our 988 Suicide and Crisis Lifeline. And to just explain that that is a 24-hour bilingual support accessible resource. We also distributed flyers to that effect. We were there to answer questions, and we emphasized the importance of mental health in times of crisis, no matter what the source of the crisis. The next activity that we engaged in since we last met with you took place on September 25th at the Doolittle Active Adult Resource Center. We hosted, where they hosted an annual picnic and health fair. About 200 older individuals attended that particular event. And it was a valuable opportunity, again, just to connect with that population in a more casual setting. But even in the most casual of settings, we're able to address health concerns and to offer resources for that population. The next example is our October 24th participation in the Binational Health Week as part of Hispanic Heritage Month. It was hosted by the Nevada Research, Education, and Access for Community Health Organization. We affectionately refer to them as REACH. And it was held at the East Las Vegas Community Center. We had an interactive booth. I happened to attend that event. It was very, very it was heartwarming, to be honest, Mr. Chair. Carlos has a very good way of keeping it engaging and knows the community that we're serving. So we had some interactive games and the ability to educate as well. We were promoting the 5210 Healthy Habits campaign, and we use a spin the wheel kind of game. And we had questions that were age appropriate, some for younger individuals, for children, and some for adults, all about healthy lifestyle. And then we gave out prizes and information. So very exciting activity. We also did a job and internship fair. This is something that we do every year with UNLV on October 9th this year. And this is where we engage and promote that NOMHE has an internship program. We've been doing this for multiple years, and it helped us and continues to help us, Mr. Chair, to build our pipeline for future public health professionals and increase awareness about NOMHE's mission. This also serves to satisfy some of those activities that Ms. Fox talked about under the workforce pipeline. So I'm happy to say, Mr. Chair, that as a result of our recruitment efforts, we're going to have 4 interns that are joining NOMHE come spring semester or January of 2026. And then moving on October 11th, NOMHE launched the first public health career focused resource fair. And this is a foundational step towards building a statewide career day model. And this model addresses the objectives that were assigned to NOMHE as part of that workforce pipeline plan that Ms. Fox mentioned. The event was at Craig's Ranch Park in North Las Vegas, and we did it in collaboration with Team DMM as part of their annual community barbecue. And it was sponsored by Assemblywoman Danielle Monroe Moreno. It was designed to not only highlight just fun and festive activities and community building, but to draw attention to public health career pathways. Some of those categories that were represented by various people who were tabling was individuals who were there to talk about career paths. Actual educational institutions where they are talking about their training initiatives and programs. And then we also had introductions to hiring agencies. Some of the Department of Human Services divisions were actually there talking about open positions and giving people the ability to understand how they could apply. And then lastly, we were talking about health literacy resources, as we always do when we do these type of events, by coordinating on-site screenings and wellness services. So it was a really, really purposeful event that day. And then also that particular event, as you can see on this particular slide, there were 30 of those organizations I mentioned who covered those tabling partners. And as a total, we had about 495 community members come through. And I think the last slide is just some photos from that day. I want to give a shout out to our advisor, Ms. Tiara Flynn, who stopped by and visited us, as you can see there in the photo. And so, Mr. Chair, that is just an update on our outreach, which does tie directly to our health literacy commission or mission. I can answer any questions. I'll do my best to answer on behalf of Carlos or Alex. Ms. Neal was the driving force behind that last event that I mentioned.
Ms. Storch, thank you so much for your presentation and for all the work that you're doing. Nick Dunkel for the record. Any questions or comments from advisory committee members at this time? Please feel free to chime in.
This is Angie Wilson. I just wanted to thank you, Tina, and all of your staff for such a great job. It's just a lot to hear all the different programs happening and the outreach happening, all the safety stuff happening. It's really awesome to see how much you all do, and just really grateful and supportive of all the work coming out of the office. So good job, everybody. Just excellent work. Thank you.
Yeah. And Advisor Wilson, and in sharing this information, we do so with such detail so that you can share it with your base, correct, with your contacts. So we really do hope you find it purposeful when we do share this information. Thank you so much.
Just a real quick follow-up to that. I'm sure that as I presented last time, the Tribal Health Authority Council hopefully will be up soon. And this is excellent information that will eventually be able to go to that entire council. So all the tribes will be completely updated and at the table for that. So it's exciting. Thank you.
And know that we stand ready if ever you need us to present, we will reciprocate. So thank
Okay,
you.
thanks.
Additional questions or comments from advisory committee members?
Mr.
Hearing
Chair,
is-
there are none. I'm ready to go on to the last report.
Please proceed, and thank you so much for all of the work that you all are doing.
Thank you, sir. So this is a standing item that happens every year about this time. As a refresher to some and as an introduction to others, the DIL function was created in the 81st legislative session, which was back in 2021. Senator Melody Scheibel introduced Senate Bill 222, which was subsequently passed and enacted into law. And that legislation is now codified as NRS 232.0083-0087. And this provides an opportunity for each state agency that engages with or provides services to minority groups to voluntarily appoint a diversity and inclusion liaison, or a DIL, within their organization if they deem this feasible. However, for any agency that does have a DIL, they must participate in an annual meeting. And this meeting is convened with the assistance of and joined by minority serving organizations from the community. We often refer to them as MSOs, Mr. Chair. Also, by way of background, and just to anchor us into this DIL activity, the Governor's Office for New Americans, as well as the Nevada Commission for Minority Affairs and NOMHE, our three organizations per statute are required to facilitate the annual meeting, Mr. Chair, for the liaisons and the minority serving groups. We are also required to extend and complete a report on behalf of those of the meeting. And this report is then submitted respectively to the Governor's Office and to the Legislative Council Bureau by January 1 of every year. And then the report is intended to summarize the findings and recommendations from that annual report. And so what I'm doing here today, Mr. Chair, is just presenting to this group what came out of the meeting. That meeting was July 23rd. A total of 56 individuals comprised of 26 DILs, and then 8 representatives from the community who serve as an organization in an organizational capacity to minority serving groups. During that 2-hour meeting, we came up with 6 thematic areas, and that you see them on the screen there. The first one was workplace environment and collaboration. The individuals who had convened identified that as one of the challenges and areas that need improvement. They identified issues of discrimination and harassment and disrespectful behavior within state agencies, that this needs to be addressed through trainings and interagency collaboration to improve communication and civility and a cultural understanding among employees. The second thematic area was the need to break down silos, Mr. Chair. The participants in the annual meeting noted that the agencies often operate in isolation, which can lead to confusion from the public, something that we always want to avoid. So the members who attended the meeting recommended stronger interagency collaboration and better communication and resource sharing. Think of a mutual aid type dynamic. The third topic was community engagement, just to decrease the gap between the governmental resources and the community's familiarity and awareness that those resources exist. The fourth particular area that they identified as a theme was the need for outreach and access to services. They just talked about, in particular, in a specific area, the need for multilingual materials and outreach strategies that represent the state's diversity. The fifth category was the need for cultural competency training. That is still very much serves a purpose. They talked about how it can serve to address systemic racism and reduce implicit bias. They talked about the value that comes from having lived experience and using that as a training module. and that they noted that leadership and frontline staff alike would benefit from more training. And then the last thematic topic that they brought up during the annual meeting was the need for internal assessment and accountability. We all know, especially coming from the health sectors that we often work in, is if you don't count it, it's very difficult to address it. And so assessments and accountability come from things like surveys and climate surveys. And they just promoted and recommended that those things are meaningful and should be adopted to address any needed changes. So as I said, Mr. Chair and advisors, that summarizes the report. It is a very short report this year. It's about a page long. So my verbal retelling is basically the report. And I'm sharing it with you today just for visibility and for informational purposes. And I can answer any questions if you have any.
Thank you so much, Ms. Dorsch, for your presentation. Any questions or comments from advisory committee members at this time? Hearing or seeing none, looks like we got some thumbs going up. I'm assuming that just means we heard everything we needed to. With that said, Ms. Dorsch, I don't have any questions. I think that was thorough. The only kind of point that I wanted to jump in on before we shift to the next agenda item was just my enjoyment of the way that this was structured this time around. I think, and I don't know if I can speak for all committee members, but I really enjoyed being able to hear from all of the different staff, the work that they've been up to. I know that we've done this at prior meetings, but just kind of hearing from Ms. Fox, Ms. Neal, yourself, in place of Carlos this time around. We really enjoy hearing all of the updates, and I think that's something that I've really enjoyed this call this time around. Just hearing everything and all the work that you're doing. I know a lot of the staff can be in the background here or there, but we love to hear the work that you're all doing because it's a lot and it's all needed. So thank you so much. With that said, I know that we've got to shift to a broader agenda item here, agenda item 7. So with that said, it looks like we have, for information and discussion only, our Department of Human Services update with our Deputy Director, Mrs. Shannon Litz. Is Mrs. Litz on the call?
I'm here, Chair.
Wonderful. Please proceed with your presentation. Looking forward to hearing from you.
Thank you so much, Chair, and thank you to the committee. I appreciate the opportunity to present today. As mentioned, my name is Shannon Litz. I serve as the Deputy Director of Programs here for the Department of Human Services. So as mentioned, I am joining to provide an update on the reorganization of the agency through the passage of Senate Bill 494 through our 2025 legislative session. We'll go to the next slide, please. All right, so with Senate Bill 494 and changes to our agency structure, the now named Department of Human Services, we are still getting used to that for sure. As mentioned earlier, it's going to be updates to the website, many things like that as we pivot to this new name, but it will take a while. The agency now includes Aging and Disability Services, Child and Family Services, Public and Behavioral Health, and the Division of Welfare and Supportive Services has been renamed to the Division of Social Services. So many changes for our agency and for the state through that session, really looking to work more efficiently. This has been a priority of the governor since he came into office. So all of these moves are really working toward that goal. And so improving our operational efficiencies, consolidating similar services, really taking a look at these agencies and the programs themselves and how all the pieces work together. So the Department of Human Services, we are going to continue to support Nevadans, focusing on population health. We serve as the safety net provider for many programs and many individuals. So all of that work is continuing. And then as referenced here on the slide, the Nevada Health Authority, previously, that was the Division of Healthcare Financing and Policy, Nevada Medicaid, that was part of the department. So under the leadership of Stacy Weeks as the director, the Health Authority as a new state department, is going to work to maximize funding and supporting just all the Nevadans that we serve. We'll move to our next slide, please. So this really just illustrates a little bit more detail on some of the programs that moved as part of either the budget process, that Senate Bill 494, which did the agency reorganization, or an additional piece of legislation, Senate Bill 466, that was a move of a program to the Department of Agriculture. So that brings the food inspections all under one roof with that move to the Department of Agriculture. Next slide, please. So I really want to talk here about the organizational chart and just this arrangement for the department. So now, as I mentioned, the department includes the 4 divisions as well as a small group of programs that reside here within the director's office, being the Office of Minority Health and Equity, the Fund for Resilient Nevada, which is our opioid settlement funds, and the Grants Management Unit that oversees a variety of grants, including tobacco settlement funds, community service block grant, and social services block grant. In addition to these, as you know, through the director's office, we have many initiatives that really kind of span the department. Our tribal liaisons are hubbed here. They work with we have tribal liaisons embedded in all the divisions to really make sure that those touch points are made. We support legislative activities across the department, all kinds of things. So as you know, and as I'm sure you're aware, this session, no changes were made to the Office of Minority Health and Equity. It's remained where it is here within our director's office. And as you heard, just so many great presentations today that the team is really focusing on just a wide variety of priorities, initiatives, all focused through their statute of NRS 232. So the Division of Child and Family Services and Aging and Disability Services, they didn't change through Senate Bill 494, continuing to support children, families, seniors, and all ages with a disability. The Division of Welfare and Supportive Services, now with its new name, continuing their mission and work with SNAP, TANF, Medicaid, child support, child care, energy assistance. And Public and Behavioral Health, as noted on the other side, there were several moves and changes within their division, and then lots of legislation that really focuses to support public health. So they're going to do several studies throughout the interim, including one on food security and the impact of the Home Means Nevada program, impacts of lung cancer, access to screenings, and also related to 494, some information on possible moves of public and behavioral health within that health authority structure. We'll go to the next slide. And then really my final slide here today, as this group I think is well aware, after a very long career in state service, Richard Whitley retired earlier this month. And Ricky Robb, who is currently has served as the administrator of Aging and Disability Services, she has stepped in as our interim director. And so the governor's office is conducting their search for a permanent replacement, but we're really happy to have Ricky here, long time with the state. She understands the department and she's just going to be an asset through this transition. So that is in process right now. And then finally, on my next slide, I'm just appreciate the opportunity to be here. Happy to answer any questions and just hear all the great updates and information through the meeting. So thank you so much.
Thank you so much, Ms. Litz, for your informative presentation here. Are there any questions or comments from advisory committee members?
This is Angie. I just wanted to say thank you, Shannon. It's always good to work with the Department of Health and Human Services. I know that here in the tribal tribal arena. We really appreciate the relationships we have with you all. And I was excited for Director Whitley for his next phase, and just sad to see him go because he's been so supportive. But I'm sure the interim is going to be great, and looking forward to who will fill that role. But thank you for presenting on some of the changes that have happened at the state level as well. We appreciate it.
It's absolutely my pleasure. I really appreciate the invitation and absolutely the collaboration just in these various areas across the department. I know different members of this body and the work that you do. I know there's a lot of overlap within our divisions. Just there's so many touch points, and appreciate the opportunity and anything I can do to help you or opportunities to collaborate further. Look forward to discussing those.
All right, hearing or seeing no additional questions. Thank you so much again, Ms. Litz, for your informative presentation. Always great to hear the updates as well. No questions on my end, but just because the presentation was so informative. Thank you for taking the time.
Thank you for having me.
Absolutely. And it looks like we can go ahead and move on to our next agenda item here. This is going to be just for some discussion as well as reaffirming quorum. I'll try to move through this somewhat quickly. I know that we have interpreters for a set amount of time here. So with that said, just for possible action, future meeting dates and agenda topics. So we have the next 3 dates set for our upcoming meetings. Those dates are February 10th, 2026, May 12th, 2026, and August 18th for our in-person meeting. So if I could reaffirm quorum and confirm quorum for these dates here, February 10th, May 12th, as well as August 18th. I know we've discussed these a little bit, but I would like to ask for any suggested topics at this time. Do we have any topics that we would like to hear at these upcoming meetings?
This is Angie, and I would just say maybe what would be good to hold is once the state hears back on its award for the rural transformation funding and how the state is rolling that out, maybe what would be good is to see an update on what's happening there. And then, I would just say this is, I think another important issue is going to be what is happening with the Silver State Health Insurance Exchange and the impact to folks, with the issue around the subsidies on whether folks can afford it or not, and what's happening with, healthcare premiums on the exchange as we move forward. I think those are really key issues for our community.
Thank you, Ms. Wilson. I'm seeing a hand raised from Maggie Salas Crespo as well. Please go ahead.
Hi, Maggie Salas Crespo for the record. I know we're in the midst of a special session that I'm hoping will be ending here soon, but they did pass a SNAP emergency bill. So I was wondering if we can have a quick overview of that bill, just because I know that it was a huge topic during the shutdown, and obviously we're really happy. I'm really happy that the legislators put in a measure in place to ensure we're not in that position again, but would like to learn more about how that's going to work.
Thank you so much, Maggie Salas Crespo. Ms. Dorch, it looks like you're taking notes, and I'm seeing some thumbs up. It looks like you've got everything down there. Yep. Okay. Any other suggested topics for our upcoming meeting dates? All right, hearing and seeing none. With that said, I'd like to go ahead and ask for a motion to approve the upcoming dates. We've already discussed a few of these, but just to remind you, February 10th, 2026, May 12th, 2026, and August 18th, 2026. So those will be the upcoming dates. It sounds like many of us could make those, but I'd like to ask for a motion to approve the dates as they've been mentioned.
This is Angie Wilson. I'll make the motion.
Thank you so much, Ms. Wilson, for your motion. Do I hear a second?
Bishop Bonnie Radden, for the record, I second it.
That's tough when we have a couple people chime in there. I think Bishop Bonnie Radden, I heard you chime in there first. So thank you so much for the second there. Would we like to have any discussion before we move to a vote? All right. So with that said, I'd like to ask all in favor of the motion, please say aye.
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 Aye. All opposed, please say nay. Hearing and seeing no opposition, the motion carries. All right, and then for our next agenda item here, we have our second public comment. So I'll go ahead and read the statement here, and you will have an opportunity to either jump in telephonically or join in here on the call. So with that said, public comment will be taken during this agenda item. No action may be taken on a matter raised under this item until the matter has been included on an agenda item for which action may be taken. The chair of the advisory committee on the minority health and equity will place a 2-minute time limit on individuals in which they may address the committee. The chair may elect to allow public comment on specific agenda item when that item is being considered. To provide public comment telephonically, please dial 1-775-321-6111. Anytime after I have announced this period of public comment. When prompted to provide the meeting ID, please enter 701-302-51#. So please go ahead and chime in if you would like. If you're on the call here via Teams, please raise your hand and we can jump in with your public comment as well. Not seeing anyone on the call with hands raised. Do we have anyone reaching out telephonically?
Mr. Chair, at this time, no member of the public has joined via phone.
Right. Looks like we have no public comments at this time. Thank you so much for participating in this meeting. With that said, I'd like to go ahead and move on to our final agenda item here, which is our wrap up and adjournment. Thank you so much for joining us here on the call, and thank you so much to the NOMHE team for providing the incredible updates that you've done, as well as all the work that you are doing. I really enjoyed this format where we got to hear from all the folks across the team. With that said, I'd like to go ahead and ask for a motion to adjourn today's meeting at 12:02 p.m.
Ms. Angie Wilson, I'll do the motion to adjourn.
Thank you, Ms. Wilson. Do I hear a second?
Bishop Bonnie Radden, for the record, I second a motion.
Thank you so much, Bishop Bonnie Radden, for jumping in. With that said, would we like to have any discussion ahead of jumping to a vote? All right. With that said, all in favor, please say aye.
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 Aye. All opposed, please say nay. All right. Hearing no opposition and seeing no opposition, the motion carries. With that said, once again, thank you all so much for joining here today. I hope you enjoyed the information from the team, and Ms. Dorch, all of the staff from NOMHE and the advisory committee members, thank you so much for your time as well. Have a great one.
Thank you, everyone. Goodbye.